Morning, everyone, and welcome to our live stream call, SOS NHS Emergency Funding, Pay Justice Now. Just before we get started, I'm going to ask if you haven't signed the petition, which is going to be handed into Rishi Sunak at 3 p.m. tomorrow, please do so now. The link is on your screen and I'll read it out to you now. It's tinyurl.com/fund NHS. That's tinyurl.com/fund NHS. And of course, a huge thank you to the over 170,000 people who've signed it already. So, my name is Kishore Kendra. I'm a cardiologist at Bart's Hospital. I've been working in the NHS for almost 7 years now and have become increasingly worried about how funding cuts, outsourcing, and repeated structural overhauls have eroded our ability to provide quality care. Some of you might have heard recently that Barts Health have decided to bring outsourced Serco workers in-house after a period of industrial action. And I think this really shows what can be achieved by collective action when everything else looks so bleak. And hopefully that should give us hope for further campaigning. Before I introduce our first speaker, I'd like to tell you a bit about SOS NHS. SOS NHS is a new coalition of campaign groups and trade unions who are demanding emergency funding for the NHS from the government to support services and staff and not the private sector. So far, our campaign is backed by over 50 organisations, including Keep Our NHS Public and the Peace and Justice Project, who are hosting this call tonight. There'll be a brief opportunity for a few questions after our speakers have had their 5 minutes, so feel free to put any questions in the comments. Please support the campaign and help us get 200,000 signatures on the petition by sharing this call and tweeting with the hashtag SOS NHS. That's hashtag SOS NHS. Our first speaker this evening is Alia Butt. She's a psychotherapist and specialist child and adult mental health service practitioner. She's been working in the NHS for 11 years and is the chair of NHS Staff Voices and is on the Keep Our NHS Public Executive Committee. Over to you, Alia.
Thank you. And yeah, thanks for joining us this evening, everyone. So as mentioned, I work in the NHS. It's Monday. I am incredibly shattered, really tired. It's Monday. And I think that's a universal experience in the NHS. I think it's a particularly desperate time in the NHS, and despite it always being quite busy and people working really hard, I think it's fair to say that we are in new and very uncharted territory in the NHS. I work in Hackney, where people are being failed in various ways by the government, by the system. Recently we've seen, I think anybody who's kind of in touch with what's going on in the media and in the community will know that we've seen very concrete examples of how the system continues to prove itself to be racist, to be systemically and institutionally sexist, and people are really suffering. People are in dire straits, and that really includes people working and people who are accessing support in the NHS. Now, the cost of living crisis, that's also going to have and is already having severe impact on staff and patients. I think, we all know that years of austerity and outsourcing to private healthcare providers, which John will speak expertly on, I'm sure, very soon, has led to real problems in the NHS. So these three demands for the campaign, the £20 billion pound funding, the end to privatisation, essentially, and proper pay for staff, they're really crucial if we are to survive as a healthcare service and as a community of people, really. Now, I'm part of Staff Voices, so I will talk about staff. Many workers are leaving the NHS, and this isn't only because they don't have the financial incentives to stay or to join the NHS, but it's because our jobs are being made so much harder, and they're so much more overwhelming than they used to be, than they need to be. And this is to do with all of those three things, the lack of funding, the lack of pay, and the continual thievery of resources, by corruption, essentially, and privatization. So In my practice in Hackney, the workload is only increasing huge amounts. Our services are being cut constantly. They've been cut for years now, and young people are being referred to one service. If they do ever get seen, by the time they get seen, if they get seen, their needs are far greater, their risk is far higher, the complexity, it's really quite disturbing, the complexity that we see in terms of mental health, psychological difficulties of young people in the NHS. There are millions. I'm not going to go into the stats of that, but there are millions of people on wait lists, many of whom never get seen, and there are many more millions of people who are not even reaching those wait lists. The workload is incredibly high. We are very thin on the ground. It's frightening times. It might not sound that important, but I found out today that I won't be able to take a break when I thought I was going to take a break. That's not going to be possible because there are too many staff members who need to take breaks. So, and it's not just me, many staff compromise on this. Many staff work far longer than they should. And I think it's really, really fair and very important to say that the NHS is at the risk of collapse, largely due to this lack of staff retention and recruitment, and of course, underfunding, and of course, privatisation. So all of these things are accentuating the difficulties that we see in the NHS and therefore in the community. Both of these things impact each other. Staff have been insulted with a 3% pay rise, and that's coming at the time marking the highest cost of living crisis of a generation. And as I've said, that pay issue, it's twofold. Patients are unhappy, and many of them don't receive essential and even more everyday care that the NHS has, since its creation, been renowned for worldwide. And that's a real shame. That's really, really sad. But really, I think it's important to remember this relationship. We've got a record number of 400 workers leaving the NHS per week, and that's for reasons of burnout and PTSD. Those who are left there are struggling, but the patients essentially lose out. It means that workers, particularly I'd say health workers, are becoming more and more overwhelmed and traumatized by the intensity, the relentlessness of the job. But we've got more unwell patients, there's fewer staff, there's less resources, there's less hospital wards, there's less ambulances. There are therefore more unnecessary deaths. In a poll, I was reading this today, in a poll of 1,395 GPs, 85% expressed concerns about patient safety. 84% have had anxiety, stress, depression over the past year, and that is, categorically linked to their job. 31% know a colleague who was physically abused by a patient in the last year. And, people are struggling, patients are struggling. They are losing their rag with staff, and it's completely understandable. 24% of GPs know a member of their general practice staff who has taken their own life due to work pressures. So, it's a really, really sad and frightening situation, I think. And there's a clear relationship, as I said, between the staff and the patients. The people who work and the millions who rely, the millions who work in and the millions who rely on the NHS, both of whom are being critically failed by a government that continues to devalue and destroy the NHS. Finally, I'll just say that I think it's important to remember that we all benefit from fighting for more money to be put into the NHS and for more money to be put into the staffing situation. We have huge numbers of vacancies, but even so, we have huge, we don't have enough jobs. So we might have the vacancies, but there still aren't even enough jobs there, vacant or not. There's just not enough. There's not enough money. There's not enough resources. And we need to encourage the government to make an actual attempt to stop the corruption, to stop the dismantling of the NHS, which is only going to be more easy, really, if this health and social care bill goes through in the way that the government want it to. Ultimately, we've all got to come together and put huge amounts of pressure on the government to reconsider its attitude towards public health as a whole. We need to understand that privatisation is what is responsible for huge levels of deterioration of quality of care that we can provide in the NHS, the quality that people have been experiencing. Privatisation is not going to make it any better. It is the problem. So it's very counterintuitive to assume that it's going to make it better. Private healthcare providers don't have the skills and the experience to provide the services as good as NHS providers. So we've really got to try and restore our ability to provide this healthcare in this country. We've got an abundance of brilliant clinicians who just need to be treated with the respect and paid properly for their work. And it's only in the interest, of the public as well as the workers. So I'm going to leave it there. But I guess my main point is we need to fight for the NHS, for its staff, and for the many, many people who need it and use it and don't get to see any help, unfortunately.
Thank you, Alia. That was great. Please remember to sign and share the petition. We're going to put the link on the screen again now, and I'll read it out to you again. It's tinyurl.com/fund NHS. That's tinyurl.com/fund NHS. Now, our next speaker is Dr. John Puntis. He's a retired consultant paediatrician, and he's worked in the NHS for 42 years. He's a co-chair of Keep Our NHS Public and also the chair of Leeds Keep Our NHS Public. Over to you, John.
Thank you very much. Well, I'm going to talk about the second of the three demands in this campaign, and that is that we're calling on the Chancellor to invest long-term in a fully publicly owned NHS and guarantee free healthcare for future generations. This means that we need to prevent further privatisation, but we also need to reverse the privatisation that we already have and to completely remove the profit motive from the provision of healthcare. Now, according to the World Health Organization, there's actually a very broad definition of privatisation. It's a process in which non-governmental actors become increasingly involved in the financing and or provision of healthcare services. So this is not just outright sale of public assets. It's also contracting out to for-profit or not-for-profit private providers. And it also includes withdrawal of state provision, which then leads to the growth of the private sector, which is very much what we're seeing at the present time. So publicly funded does not mean not privatized, which is the argument that the government often make. If you don't have to open your wallet when you go and have care, hand over the cash, then it's public. That is not how the World Health Organization would see it, and it's not how SOS NHS would see it. And there's a long list of failed engagement with the private sector in the history of the NHS while the market was being established in healthcare. It started off in 1983 with competitive tendering being introduced for the provision of domestic catering and laundry services. This led to a whole series of failed contracts, but also is thought by many to be responsible for the huge increase in serious hospital-acquired infection as cleaning standards fell. In 1988, there was massive privatisation of social care following the Griffiths report. And this has led to the current huge problems in provision of long-term social care, with the obvious knock-on effects this has had on the NHS. 1991 saw the private finance initiative introduced under the Major government. This was a way of funding capital schemes, 100 hospitals or so, but this is hugely expensive and amounts to a new form of public sector debt, which has been a really heavy burden on the NHS. In 2000, the Labour government did increase health spending, and that was good, but there was also a concordat with private hospitals so that they would take NHS patients, and actually an aim that they would take about 10-15% of elective surgical procedures, despite the fact that costs of that care in the private sector were about 40% higher than what they would be in the NHS if the NHS had received the necessary investment. We also had private companies taking over NHS hospitals. Firstly, Good Hope Hospital in the West Midlands, and later on, when Cameron was in power, Hinchinbrook Hospital. These were supposed to be flagship enterprises, showing us a way that this partnership with the private sector could work. But actually, both of them failed dismally and had to be taken over again by the NHS. 2004, independent sector treatment centres came along. These took NHS staff, took low-risk patients, were paid even if referral numbers dropped, and they ended up costing the care in them costing about 11% more than in the NHS. Again, the NHS, the taxpayer, subsidising the private sector. Then in 2011, the Lansley Health and Social Care Act put competition centre stage, with competitive tendering now being mandatory, and GPs in clinical commissioning groups being the budget holders deciding where money should be spent. Currently, CCGs spend around 15% of their budget on services which come from private providers. And administration costs in the NHS. In the early days of the NHS, before any of this contracting out came along, the admin cost of the NHS was about 5% of budget. By 2005, it had risen to about 14%. And no one knows what the figure is now, but it's very likely to be higher than that. And when people want to say there's a lot of waste in the NHS which needs addressing, what they should really be highlighting is the waste which is the result of these market reforms, contracting that have been brought into the NHS. That's very wasteful. Let's get rid of that and put that money to good use in looking after patients. Now, the Health and Care Bill, which is currently before Parliament, there's a very succinct description of that from Alison Pollock. She said it's an astonishing attempt to allow the Secretary of State an enlarged NHS England, a quango, and new public-private integrated care boards to reduce services, limit expenditure, and further degrade local accountability and entrench the market. And we think that the Health and Care Bill should be voted out of Parliament because it's not going to do anything to help patients, and it's not going to do anything to resolve huge problems like the staffing crisis that Alia has already spoken about. In fact, with the current market model, the abolition of the competition rules, which the Health and Care Bill is supposed to be bringing about, they're actually not about more cooperation, but actually about abolishing the checks against corruption and cronyism, which is so important. And of course, have been hugely highlighted by experience in the pandemic, with lots of crony contracts being handed out without the usual process of scrutiny. In the integrated care systems, there's a real worry that private companies will have a lot of power and influence. This is debated, but certainly there seems to be plenty of scope for them to be involved with decision-making committees. And they're certainly going to be in the provider collaboratives. And these are actually described by government as playing a very active and strong leadership role in healthcare and being the principal engine of transformation. So just to sum up in the last minute or so, what is the philosophy behind privatization, and why do groups like KOMP object to it, and why does SOS NHS want to see it done with? Well, the philosophy behind privatization is actually minimizing the public sector, holding down taxes on the rich and big business, and being able to hand contracts to mates so they can make profit. And the consequences for the rest of us are that private services restrict access. They have eligibility criteria. They don't want the most complicated and difficult patients, for example. Price competition doesn't result in improved quality. Experience shows that it drives down quality. Services become fragmented rather than integrated, and the value of contracts are often opaque and highly questionable. We also know it usually means staff pay and conditions are driven down completely the wrong direction. And there have been warnings from the home of privatized healthcare in the US. Academics look at what's happening here and say, for goodness sake, don't follow our model in America. And you have to remember that investor-owned healthcare firms are not cost minimizers. They're not there to drive down costs. They're there to maximize profit. Market reforms offer a covert means of wealth distribution, redistribution of income in favor of people who are already affluent and rich and powerful. For profit healthcare companies everywhere, the world over, their characteristic behavior is to fix prices, generate illegitimate income through fraud, engage in collusive and monopolistic behavior, and win public sector contracts through cronyism. So with the current legislation pending, simply claiming to be shifting the policy goal of the NHS from competition to collaboration, as in the current bill, it does not mitigate these risks from the private sector. And that's why we say to the Chancellor, we want investment in a fully publicly owned NHS, a guarantee that there will be free healthcare for future generations. The NHS is a crucial part of the social wage, and this is even more clear and even more important as the cost of living spirals upwards and wages are worth less and less. So after that, we need new legislation to get the market out of healthcare and re-establish the NHS, an NHS that's publicly provided, publicly accountable, and based on its founding principles, which are just as important today as they were in 1948 when the NHS was created. Thank you very much.
Thanks a lot for that, John. And next we have Holly Johnston, a cancer nurse who's been working in the NHS for 18 years and a lead activist with NHS Workers Say No.
So with this year's budget, it is vital that we see true investment of the NHS, its services and its staff. For over a decade, we have seen services being sold off, patient safety suffer, and staff conditions and pay get worse. And this was happening before the pandemic. Now we have millions of patients on waiting lists that we cannot get through without urgent funding being put into the NHS and paying staff what they deserve as an incentive to not leave the NHS, but also as an incentive to join it, to come and work for the NHS. Funneling money into private companies and then profiteering is not the answer to deal with the backlog of waiting lists we have in the NHS. Neither is using agency staff, who are mostly NHS staff doing extra shifts to make ends meet and help the service out. We need to tackle the problem at the root, and this government has deliberately kept NHS staff wages low. The government have recommended a 3% pay award this year, which is nowhere near inflation and represents yet another cut to workers' pay. We have millions on waiting lists, we cannot recruit or retain staff, and the government's refusal to pay us properly is just driving workers further into poverty and will only accelerate the rate at which staff are leaving. This is a political choice. On the front line, the impact of the cuts to the NHS is evident in the services we provide. We are seeing maternity hospitals being closed down, exhausted staff doing the job of many, unmanageable workloads and poverty pay. Patient treatment options are being impacted and health outcomes worsening. Operations are being cancelled, patients being treated on corridors, and ambulances queuing to get into hospitals where there are no beds. Beds in the NHS, which have halved in the NHS in the last 30 years. Tackling the problem at the root means investing in better wages for NHS staff who have faced pay erosion for over a decade with pay freezes and cuts. And this is something we are seeing across the public sector, and we must work in solidarity to apply pressure to this government. Community NHS staff are struggling to pay their fuel bills and be recompensated for it. There have been no increases since 2014. Wear and tear payments have been scrapped and fuel prices have rocketed. Many staff are unable to afford to pay for these costs up front. The cost of living crisis impacts massively on the NHS. The health of the nation is suffering, and the increases in our energy bills, food, national insurance, and inflation will affect the working class and those most vulnerable in our society disproportionately. Life expectancy for the first time in 30 years has slowed down. There is an increase in inequalities, and the health of the poorest people is getting worse. The UK needs a pay rise, and the cost of living crisis is a public health issue. Half of the NHS are on minimum wage, and as of April, Band 2 staff will be below a real living wage. We have over 100,000 vacancies, and staff are leaving at a fast rate, not to mention the effect long COVID and mental health and moral injury to our workforce. We are seeing colleagues leave the NHS to work for private companies for what initially looked like better pay and terms and conditions, but is soon revealed as an erosion of workers' rights and simply speeds up privatisation. By not addressing the core issues of inadequate funding, privatisation, outsourcing and staff pay, it leaves the door wide open for the further destruction and dismantling of our services. This will impact on society as a whole at a time when healthcare is unaffordable to the majority of people. It's our support workers, porters, cleaners, security, admin and catering staff who are the backbone of the NHS and the lowest paid. And it's these services that are targeted and the first to be outsourced to private companies. We need to address fair pay and fight to keep decent terms and conditions in the NHS. It's people like us that have kept this country going in the pandemic, and it's us that are paying for this crisis with our physical and mental health and in our pay packets. We should not have to choose between heating our homes or feeding our families. People do not want to come into a job where they will struggle to pay off their student fees, where we are not valued and the pay does not match the skills and responsibilities that we have. We want to work for the NHS. We want to give our patients safe, quality care. And we are not asking for more pay to be greedy, but because it's owed, because it is a clear, deliberate lack of investment in the future of the NHS, because this government does not want the NHS to survive. We know the money is there to pay people a fair wage. The government has wasted over 37 billion on a failed track and trace system and PPE contracts that benefit their mates. The Bank of England governor on £500,000 a year has told us we need to see restraint in pay bargaining, otherwise inflation will get out of control. Yet profits for big bosses have soared. A wage rise for all workers in this country is much needed and well overdue. We need to fight for a wealth tax, stop the profiteering, and we need public ownership of the NHS and to fight against cuts and privatisation to all services. We have a national emergency in the NHS and we need to be working with our unions to demand what we deserve and owed and to fight for the safety of our patients. Nationally, we are facing a crisis. We have an opposition who appear to be applying little pressure to arguably the most cruel and corrupt government we have ever seen. This is why campaigns like SOS NHS are so important. We need to be mobilising across the trade union and labour movement, along with grassroots groups and other campaigning organisations. We are stronger together and the government know this, so we mustn't be divided. Please support this campaign. Join us tomorrow as we protest at Old Palace Yard and deliver our petition to Downing Street. Thank you and solidarity.
Brilliant. Thanks, Holly. Finally, we're going to hear from someone who probably needs no introduction. Jeremy Corbyn, MP, former leader of the Labour Party and MP for Islington North.
Thank you very much. Can you all hear me okay? Excellent. Yeah. I'm sorry I've only just got onto the call. I heard the last couple of contributions. We've had a debate today on the disgraceful situation facing seafarers who were employed by P&O and the way in which they were sacked. Just hear this. We heard in Larne in Northern Ireland, as the P&O ferry drew ashore, the crew had all been told it was their last day of service and they've got to be dismissed and we're going to have to leave the vessel immediately. They're met by two buses on the quayside, one of contract workers being brought in to do their jobs on pay rates as low as £1.80 an hour, and the second bus was full of trained security staff who were apparently qualified, I use the word advisedly, to carry a taser gun and handcuffs and wore balaclavas before going onto the ship to make sure all the staff left the ship on time. That's modern Britain for you. That's the brutality of the lack of employment protection law. I'm just so shocked by all of this. So when we defend our rights and defend our public services, I think we should always go further. It's not just about defending the P&O jobs or defending the NHS, it's about demanding something better within our society. And so, as we come out of COVID, recognise the work that so many people did in the NHS and the care sector and delivery sector, and so many others did. But also appreciate the dangers of their job, the dangers to their health, but also now the dangers to their very livelihood, as more and more NHS services are outsourced, sold off, and services no longer universal within the NHS, but by a plethora of private companies, and local health authorities become more and more places of management of different contracts. Go further down the road, and this won't be an NHS that you and I would recognise as a health service. Instead, what it will be is a business model which actually employs large sections of the private sector. And further on down the road, that is then very easy to convert into an insurance-based system, which will end up with virtually the privatization of our entire NHS and the principle behind it of healthcare free at the point of need. And so demanding something better and something different, as well as defending the NHS, is very important. The Health and Social Care Act opened the door to outsourcing and privatisation, and that has continued apace. And even in my own constituency, GP practices have been privatised to an American company. When you go there, it's still got an NHS badge on the door, and the people there all think they're working for the NHS. They're not. They're working for a private company, because that is what we've come to. And so I think we should be doing a couple of things. Well, many things really. One is obviously defending the principle of the NHS and healthcare free at the point of need. Secondly, in addition to defending the National Health Service, we should also be demanding a National Care Service on the same principles as the National Health Service. Because let's face it, many of us are going to need care at some point in our lives. Do we want it to be a burden on our families and our local community, or do we want it to be something that we're entitled to as a right in our lives? And I absolutely want the latter. So I think we should be demanding a national care service, free at the point of need, in the same way as others are. People say to me, well, that's going to mean that a lot of very well-off people will get care. I said, it will mean that everybody gets care in exactly the same way as the National Health Service does. We should tax people fairly. Obviously, the richest should pay much more in tax, but that way we can deliver universal services that are very important. One of the previous speakers mentioned that the government had managed to waste £35 billion on track and trace during the COVID pandemic, and that's absolutely true, they did. That money is disgraceful. It was wasted by Serco and other companies, and they threw money at the private sector to deliver, when there was a perfectly credible option there available of public health service and in relationship with local authorities who could do, and where they did it, a much more efficient track and trace system than the private sector could ever do. But that wasn't the end of the waste of money during the pandemic. I support the right of everyone to get a vaccine. I support spending public funds on research in order to produce vaccines. I support spending public funds on medical research in order to produce the medicines of the future, the pharmaceutical medicines of the future. But Big Pharma are very powerful. Big Pharma are very, very profitable. And Big Pharma can hold the NHS to ransom on the prices they charge for individual vaccinations, for other medicines and so on, which is why I was very keen to put into our 2019 manifesto a commitment to produce generic medicines at price in a publicly owned company. I think these are all demands that we have to put forward. And the last point I make is this, and it's about NHS staff. Before I became an MP, I used to be a union organiser in local government and the National Health Service. And what always impressed me was the sense of commitment of people in both local government and the National Health Service. The number of nurses and nursing assistants and radiographers and admin staff and all the other different sectors within the health service who often work way beyond their hours. Care workers who are so worried about a client that even though they're not being paid for it, they'll go back of an evening to see if they're okay and give them support. The moral blackmail that goes on consistently to health care and public service staff is something that is really quite outrageous. So we need properly paid staff. We need care staff that have got sufficient time to undertake their work, and we need properly staffed hospitals by directly employed staff, not agency staff or company staff that have been pushed in to do it, because that can be the only way in which we can have a fully functioning and efficient National Health Service. That means a pay rise. 15% seems to me to be about right, perfectly reasonable, because the pay freeze ever since austerity of 2010 has hit very hard on health workers, and there are so many people working in the NHS which at the same time have to access food banks or food co-ops just to be able to feed themselves and survive. They work very hard for all of us, and we should ensure they're properly paid. We live in a deeply unequal society, and the inequality in our society is getting worse and worse. So the NHS has to pick up all those pieces of that inequality, but it's up to us to politically demand and show an alternative so that the next generation isn't bequeathed inequality, injustice, underfunded public services where free market economics is the only option. We have to produce something a bit better than that. So let's start by mobilizing people with the reality of the danger to their National Health Service of the policies that are in operation at the present time. Thank you very much for inviting me on the call this evening. Again, sorry I was a little late coming on the call, but I'm sure you'll understand the importance to be in the chamber to vote in support of the P&O workers and their fight for their jobs and their justice. Thank you very much.
Thanks a lot, Jeremy. And I think I can't stress enough the importance of demanding a national care service, publicly owned and publicly funded. As many of us who work in hospitals will know, that's one of the primary factors in bed pressures. So I think we're going to move on to a couple of questions. The first one, I think I will direct initially to John and Holly. How does the cost of living crisis and the energy crisis make these demands even more important now?
Shall I come in? So yeah, the cost of living crisis will affect the health of the nation massively and exacerbate health inequality and apply pressure on the NHS in that way. But also it will mean that it could be a tipping point for already undervalued staff as they struggle to afford to pay their bills, choose between heating and eating. And, you know, this is no way to treat staff of an essential service that should be publicly owned. Yeah.
Kishore, do you want me to
yeah, if you want to. Yeah.
I mean, I obviously agree with Holly. I mean, there's tremendous pressure on people's incomes at the moment, and one of the very obvious effects of increasing cost of living is that it's driving a lot of people into poverty. Now that has a devastating long-term effect on people's health, and of course on children and their long-term health. It just raises the whole issue of how the social determinants of health in terms of income, employment, opportunity, schooling, food choices, good housing, all these things are absolutely crucial to people's health. And if we want to reduce inequalities, they're actually more important than the NHS, although the NHS of course, is what we're talking about. But it's going to make it much more difficult for people to live healthy, extended lives. We're already seeing life expectancy stalling and healthy life years reducing, and that's going to get worse. So it's going to have a devastating impact on the people who are already suffering the most, the poor and disadvantaged single parents and children.
Okay, thanks, guys. Yeah, I mean, I completely agree. It's universal basic services are essential to sort of providing essential support for people to tackle those social determinants of health. And many of you will know the Marmot report, which detailed all of this in 2020, and COVID has very much highlighted all of those issues. The second question, I think, would be what happens if Rishi doesn't deliver on the NHS demands that will be asked in this budget on Wednesday? That will go to Jeremy and Alia.
Well, I'd be very surprised if he did deliver on all the demands that have been put in on health spending. In fact, all the indications are it's going to be a budget that will underfund health and local government, and probably increase national insurance costs in the future. I'm not expecting any particularly good news to come out of it. That means that we have to do two things. One is demand, but also recognize that inequality means that it's the poorest people that suffer the most. Lowest wages lead to the worst food, childhood poverty leads to underachievement, and so it goes on. And it is a question of mobilizing people on the needs of the NHS and also challenging some of those areas where the NHS would be a lot better off. One of them is the question I raised of big pharma, but it's also the question of the handing out of contracts all the time. So it is also important to have local health activity as well to challenge the decisions being made by local health authorities on their spending plans and how they deliver those services. It's a question of campaigning and mobilizing people. The NHS was only founded because people of belief campaigned for it. It's only been sustained because of all of our beliefs in it. You think of the number of protests all over the country that have prevented hospitals being closed, that are making a big difference, and they're dogged, determined, and continue. That's what we've got to do. So I think we're going to be seeing a lot of each other on this campaign for a real universal national health service and a national care service.
Yeah,
Thanks
I mean,
a lot. Oh, sorry.
I'm sorry, I was just going to jump in.
Yeah, go on. Yeah, sorry.
Well, I was just going to say, you know, I think we all know, really, don't we, that tomorrow we're not going to see even a fraction of what's needed in terms of funding for the NHS. And I think it's fair to say that the exploitation and the general disregard for the NHS is very, very much linked to the exploitation, dehumanization, and general disregard shown for the public, for the working class, and particularly the minorities among us, you know, who will struggle far more due to the underfunding that we're going to see, you know, the lack of funding that we're going to see in the budget, and the general increase in poverty. You know, as everyone said, we're going to probably, well, the figures are that 400,000 people could be pulled into poverty by real-term cuts to benefits, for example, by April. And I think the figures are going to be far greater than that. And as John mentioned, you know, there's a growing body of evidence, mainly from high-income countries, actually, that has shown that socioeconomic factors, you know, there's a huge component, that's a huge component in the development of mental illness. And that really leans on people with lower socioeconomic status. So I think that's just going to be increased. I think that's going to increase the pressure on the NHS. It's all linked. And I agree, you know, we have to put pressure on the government to have a different tack, you know, to rethink public health and to rethink the way that they structure their budgets, they structure society, because we are going to really, really struggle far more in the NHS than we have been, and we are really struggling.
Thanks, Elliot and Jeremy. I thought I might come in with another question, which I think is important because a lot of people are trying to think about solutions to the crisis that the NHS is going through, and specifically, actually, the huge waiting list that we've generated over COVID. And what you may see across the spectrum is some people arguing that we need to mobilize the private sector in order to deliver on cracking down on the waiting list, as long as everything is free at the point of use. What would you say to someone who's making that argument? I'll put that out to kind of anybody who wants to jump in.
Well, if I could jump in first on that, I was thinking at the start of the COVID pandemic, when it was pretty obvious that hospitals and care services simply were having real difficulty in coping, I think I'm right in saying on December the 15th, 2019, bed occupancy was already at 90% in some places. Not everywhere, but some places. So they were then having to try and free up bed spaces in January, February, March as the COVID issue took over. That was before COVID, those rates of occupancy. And the same problems applied in care. And so they then started buying places in the private health service. Well, I'm not sure I would have been so generous to the private health services to buy places in them. I think we should have said, as a nation, we need these health resources. We need these health resources for everybody. I even heard Boris Johnson himself saying nobody should pay for a vaccination or a test. It should be free for everybody. He was right on that. And so I think we should have taken over those private hospitals that needed to be taken over in order to provide proper services for everybody. We cannot have it that people can effectively buy their way past any waiting list within the NHS. We should be, if we accept the principle of healthcare, free at the point of need for everybody, then that point of need should be based on your medical needs, not the size of your wallet.
Could I come in as well, Kishore?
Yeah.
I mean, the private sector is relatively small, so about 8,000 beds. Hospitals average 48 beds, generally lack intensive care facilities. Where do their staff come from? The NHS. So they actually undermine the NHS rather than strengthen it.
Yeah.
You've seen this recently with many ophthalmologists who've written to NHS England saying that the private sector is taking ophthalmologists to do cataract surgery, and that's causing a huge problem with training NHS ophthalmologists and also dealing with complicated urgent eye surgery, non-cataract surgery. And that's just one example of how the private sector actually undermines. Now, the strategy in the pandemic, of course, was to throw money at the private sector for everything, including a deal with the private sector to help the NHS manage the COVID burden. What did they do? They simply increased the amount of elective surgical work that they were doing and looked after hardly any COVID patients. And those contracts still remain far from transparent, but the Centre for Health in the Public Interest have looked in detail at it and said actually the NHS got an extremely bad deal, but what it did was to keep the private sector afloat during a pandemic crisis when a lot of businesses were going to go to the wall. So to me, it doesn't make sense to give money to the private sector to help the NHS. That money should go into long-term investment to improve a national health service for all of us. And the private sector does not provide any kind of model for how healthcare should work. They cherry pick, they're generally unsafe, they're always more expensive, and they actually undermine the service that is there for the majority of people who can't afford to pay.
Okay, thanks. I've actually got some stats on the kind of private outsourcing and provision that was done during the pandemic, based on the report done by the CHPI think tank. So they only treated, at a cost of between £2 to £5 billion funding, 0.08% of COVID cases, and the actual NHS funded elective care that they were also commissioned to do fell by about 43%. So if anyone's wondering about how this has worked in practice, that is an example of that. Okay, so on the 22nd of March, which is tomorrow, SOS NHS will be holding a budget stunt and petition hand-in to Downing Street with NHS staff, campaigners and cross-party MPs. To start the day, NHS staff, campaigners and MPs will travel around central London on an open-top bus, making a ruckus. They will then be assembling at 2:15 p.m. at Old Palace Yard, opposite Parliament in central London, for a visual stunt around the budget, to include red briefcases and Rishi Sunak masks, before marching to Downing Street for the petition hand-in. So everyone's welcome at 2:15 at Old Palace Yard. The SOS NHS petition has around 180 signatures now, and calls on Rishi Sunak to deliver increased NHS funding ahead of the spring budget on Wednesday. We'll be sharing another link to the petition if people still want to sign it, and I'll just read it out again now just for everyone to hear. So that's tinyurl.com/fund NHS. That's tinyurl.com/fund NHS. So I'd just like to close with thanking everyone for tuning in. And I'd obviously like to thank in particular the people who given up their evening rather, to inform us about the campaign and what will be going on. So thanks Alia, John Puntis, Holly Johnston and Jeremy Corbyn. Please support SOS NHS, keep our NHS public, the Peace and Justice Project, and all the campaigns fighting for a free and public health service, and so much more. Sign the petition if you haven't already, and encourage your friends to sign it. The petition will close around midday tomorrow and just before we hand it in to Rishi Sunak. So please share this evening. Our NHS needs this government to give it and the staff working in it the funding and resources and pay that they need. So thanks all for your support. And see you tomorrow.
Thanks, everyone.
Thank you.
Thank you very much.
See you tomorrow.
See you tomorrow. Bye.
Bye.